Listen to this amazing story of miraculous healing. Enjoy listening. The 5 a.m. alarm was less a jolt and more a gentle hum, a familiar prelude to the meticulously orchestrated symphony of Charlotte's day. Black coffee, brewed strong and silent, was her first ritual, followed by the crisp snap of her St. Jude's Hospital nurse's uniform, ironed to perfection the night before. At 53, Charlotte Davies was an institution in herself within the surgical wing, a bedrock of calm efficiency, her movements precise, her voice steady, even amidst the controlled chaos of the operating theater. She was the one nurses turned to when a line wouldn't cooperate, the one doctors trusted implicitly to anticipate their next move, the one patients, even in their groggy wake, seemed to find comfort in. Control wasn't just a professional ethic, it was the filament around which her entire life was wound. "Morning, Charlie. Up with the chickens, as always." Beatrice's voice, already a little too loud for 5:30 a.m., chirped from the living room. Charlotte stepped out of her bedroom, a faint crease forming between her brows. Beatrice, her younger sister by a decade, was a whirlwind of vibrant scarves and half-finished canvases, perpetually optimistic and chronically underemployed. She'd been crashing on Charlotte's sofa for the past 3 weeks, an unexpected casualty of a particularly brutal landlord dispute. "Don't you ever just sleep in, like till noon? It's glorious." "Some of us have responsibilities, Bea," Charlotte replied, a ghost of a smile playing on her lips as she poured Beatrice a cup of coffee. It was a well-worn banter, a comfortable push and pull that had defined their relationship since childhood. Charlotte, the responsible eldest. Beatrice, the free spirit. "Point taken, Florence Nightingale." "Oh, Finn called. Said he needs help with his tax forms again. Can you believe it? He's a coding genius, but a receipt is his mortal enemy." Beatrice gestured vaguely with a paint-splattered hand. Charlotte sighed inwardly. Finn, Beatrice's son, was 28, brilliant in the abstract world of algorithms, but utterly lost in the practicalities of adulting. He relied on Charlotte for everything from setting up his internet to navigating car insurance. Another responsibility, another testament to her indispensable nature. She wouldn't trade it, not really. There was a quiet satisfaction in being the anchor, the one everyone depended on. She prided herself on her self-sufficiency, a trait honed over decades of being the family's immovable object in a world of shifting sands. Lately, though, a faint tremor had begun to ripple through her carefully constructed world. It started subtly, a persistent bloating after meals, an early satiety that meant she was leaving half her dinner untouched. She'd always had an iron stomach, impervious to stress or irregular schedules. She dismissed it as just stress, the pressures of the ward, Beatrice's chaotic presence, Finn's incessant demands, or perhaps, she mused, just getting older. 53 wasn't old, not really, but the body did start to betray you in small, insidious ways. A little indigestion, a bit of fatigue that lingered even after a full night's sleep. Nothing a good probiotic or an extra shot of espresso couldn't fix. The operating room that morning was bustling, a standard appendectomy, followed by a more complex gastric bypass. Charlotte moved with effortless grace, anticipating every instrument, every suture. But by the afternoon, a dull ache had settled deep in her pelvis, a new, unwelcome guest. It wasn't a sharp pain, more a persistent pressure, like a fist clenching inside her. She attributed it to standing too long, the unforgiving hospital floors. Yet there was a flicker of something she couldn't quite name, a quiet unease that her usual rationalizations couldn't fully extinguish. She pushed it down, as she always did with anything that might disrupt her equilibrium. Charlotte Davies didn't have time for vague aches and pains. She had patients to care for, a family to hold steady, and a perfectly ironed uniform to keep pristine. The world depended on her unwavering composure, and she, in turn, depended on her body to always comply. "Morning, Charlie. Up with the chickens, as always." Beatrice's voice, already a little too loud for 5:30 a.m., chirped from the living room. Charlotte stepped out of her bedroom, a faint frown creasing her brow. Beatrice, her younger sister by a decade, was perched precariously on the arm of the worn armchair, a half-eaten granola bar in one hand, her phone clutched in the other, already immersed in a chaotic tapestry of social media. Finn, Beatrice's son, was typically still cocooned in his room, the distant hum of his computer the only sign of his early morning existence. Charlotte sighed, a barely audible puff of air. Beatrice, a free-spirited artist whose canvases were as vibrant and unpredictable as her life, was currently navigating another creative block that Charlotte suspected was more akin to chronic underemployment. Finn, brilliant but socially anxious, often sought Charlotte's practical grounding in a world that felt too loud and unstructured for his analytical mind. Charlotte was, as always, the silent, unwavering anchor for them both. "Beatrice, it's 5:30, and please don't leave crumbs on the upholstery. We discussed this." Charlotte's voice was calm, but the underlying weariness was a faint tremor she barely acknowledged. Her own breakfast was a meticulous affair. Measured oats, a handful of berries, and the second cup of black coffee, consumed while reviewing her mental checklist for the day's surgeries. Control, precision, order. These were the tenets she lived by, the bulwarks against the inherent chaos of life. Lately, however, there had been subtle cracks in her carefully curated routine. The persistent bloating, initially dismissed as a consequence of her age, or perhaps a reaction to a particularly stressful week, had become a constant, uncomfortable presence. It wasn't just a feeling of fullness, it was a distension, a pressure that made her crisp uniform feel tight around her middle by mid-afternoon. She tried all her usual remedies, increased fiber, cutting down on dairy, even a brief uncharacteristic flirtation with herbal teas, but nothing offered more than fleeting relief. Then there was the fatigue. Charlotte had always prided herself on her stamina. A double shift, back-to-back surgeries, an overnight emergency, she'd sailed through them all, fueled by an almost preternatural reserve of energy. Now the exhaustion was a leaden cloak, weighing her down even after a full night's sleep. She found herself needing to lean against the scrub sink for a moment longer than necessary, her shoulders aching, her eyelids heavy. She'd even caught herself nodding off on the sofa for 10 minutes after her shift, something utterly unheard of for her. She attributed it to the sheer volume of complex cases lately, or perhaps the changing seasons. "Just stress, Charlotte," she'd tell herself. "You're not getting any younger." A particularly intense, sharp pelvic pain had struck her during a long appendectomy last Tuesday. It was a sudden, searing jab that made her clench her jaw, her hands momentarily freezing above the patient. She'd quickly regained her composure, attributing it to a strained muscle from leaning over the operating table for hours. But the pain, though less acute, had lingered, a dull ache that resonated deep within her pelvis, a low thrumming bass note beneath the constant bloating. "Charlotte, are you all right?" The voice cut through her internal monologue, startling her. It was Maya, her bright-eyed, earnest mentee, a new graduate nurse Charlotte had taken under her wing. Maya, barely out of nursing school, possessed an almost frighteningly keen observational sense. They were charting post-op, the fluorescent lights of the nurse's station casting a pale glow on their faces. Charlotte straightened, adjusting her glasses. "Of course, Maya. Why wouldn't I be?" She tried to inject her usual crispness into her tone, but even to her own ears it sounded a little brittle. Maya's brow furrowed, her gaze unwavering. "You look a bit pale, Charlotte, and you've been rubbing your stomach a lot today. Are you sure you're not coming down with something? There's a nasty bug going around." Charlotte offered a dismissive wave of her hand. "Nonsense, just a touch of indigestion. Too much hospital coffee, perhaps." She forced a smile, a practiced professional mask. "Now, about Mrs. Henderson's pain management plan." Maya didn't push, but the seed of genuine concern she'd planted took root. Charlotte prided herself on her diagnostic acumen, honed over 3 decades of clinical practice. She could spot the subtle signs of sepsis, the early warning of a cardiac event, the nuanced presentation of a neurological deficit. But when it came to herself, she found an almost perverse ability to rationalize away every symptom, to dismiss every red flag. It was easier to ignore, to push through, to maintain the illusion of her own unyielding strength. To admit vulnerability was to acknowledge a crack in the carefully constructed edifice of Charlotte Davies, the unbreakable nurse. Yet Maya's quiet observation, combined with the persistent, gnawing discomfort, finally wore down her resistance. It wasn't a dramatic collapse or a sudden epiphany. It was a slow drip, a steady erosion of her self-denial. After a particularly uncomfortable night where the bloating was so severe, she couldn't lie flat without a dull ache in her back, Charlotte found herself with a surprising lack of fanfare, dialing the number for her GP, Dr. Anya Sharma. Dr. Sharma was a relatively new addition to the practice, a woman Charlotte respected for her methodical approach and a calm, reassuring demeanor that somehow managed to be both empathetic and clinically precise. Bloating, fatigue, occasional pelvic pain, Charlotte recited, listing her symptoms with a detached professionalism, as if she were presenting a patient's case rather than her own. She omitted the intensity of the pelvic pain, the sheer exhaustion, the growing sense of disquiet that had begun to whisper at the edges of her stoicism. Dr. Sharma listened patiently, her expression unreadable. She performed a thorough physical examination, her touch gentle but firm. "Charlotte, given what you're describing in your age, I'd like to order some tests, a full blood panel, and an ultrasound to start, just to rule out anything serious." Her voice was measured, but Charlotte, with her finely tuned medical ear, detected a subtle shift in tone, a flicker of something she couldn't quite place. Not alarm, but perhaps a heightened sense of caution. "Of course, Anya," Charlotte replied, already mentally adjusting her schedule to accommodate the appointments. "No stone unturned, right?" She tried to sound nonchalant, but a cold knot of apprehension had begun to form in her stomach, a sensation far more unsettling than mere indigestion. For the first time, the whisper of unease had grown louder, threatening to become a shout. The subtle unease that had been Charlotte's unwelcome companion for weeks finally solidified into something undeniable. The bloating wasn't just persistent, it was now a tight, uncomfortable pressure, making her uniform feel a size too small by midday. Fatigue, once a fleeting shadow, was now a lead blanket, making the simple act of standing for hours in surgery an act of sheer will. And the pelvic pain, initially dismissed as an occasional cramp, had sharpened into an insistent gnawing, particularly after a long shift, radiating in a way that felt wrong. She had always prided herself on her diagnostic mind, her ability to read a patient's subtle cues, yet she had stubbornly refused to apply that same rigorous observation to herself. It was Maya who finally broke through her self-imposed denial. The young nurse, still navigating the demanding rhythms of St. Jude's, had become a quiet fixture at Charlotte's side. Charlotte had seen potential in Maya's meticulousness, her quiet dedication, a reflection of her own younger self. One afternoon, after an unexpectedly grueling 8-hour appendectomy, Charlotte found herself leaning heavily against the scrub room wall, a faint sheen of sweat on her brow. Maya, gathering instruments, paused, her brow furrowed with genuine concern. "Charlotte, are you all right?" Maya's voice was soft, hesitant. "You look really pale. You've been looking a bit off for a while now. Maybe you should get checked out." Charlotte straightened immediately, a flicker of annoyance crossing her face. "Nonsense, Maya. Just a long day. You know how it is." She forced a dismissive smile, but even as she spoke, a wave of dizziness washed over her. She gripped the cool ceramic tiles of the wall, steadying herself. Maya didn't press, but her eyes held a knowing worry that Charlotte couldn't entirely shake off. The seed was planted, watered by Maya's uncharacteristic boldness and Charlotte's own worsening symptoms. That night, the bloating was so severe it felt like a balloon expanding inside her, the pain a relentless throb that aspirin barely touched. Lying awake, staring at the ceiling, Charlotte finally admitted to herself what she had known, deep down, for weeks. This wasn't just stress. This wasn't just getting older. The next morning, with a reluctant click, she found Dr. Anya Sharma's number in her contacts. Dr. Sharma was a trusted colleague, a GP Charlotte had occasionally referred patients to, known for her sharp mind and compassionate approach. Scheduling the appointment felt like an admission of defeat, a crack in the impenetrable armor of her self-sufficiency. "Charlotte, it's good to see you." Dr. Sharma's smile was warm, but her eyes, as she took in Charlotte's slightly hollowed cheeks and the subtle slump of her shoulders, were professionally assessing. Charlotte recited her symptoms in a clinical monotone, as if describing a patient's chart. Persistent bloating, early satiety, intermittent pelvic pain, increasing fatigue. Dr. Sharma listened patiently, nodding, occasionally interjecting with a precise question. She then performed a thorough physical exam, her touch gentle but firm. "Your abdomen is quite distended, Charlotte," Dr. Sharma noted, her fingers pressing lightly. "And there's some tenderness here." She paused, her gaze meeting Charlotte's. "I'd like to order some tests, a full blood panel, and I want to get an ultrasound of your pelvis and abdomen, just to rule out anything serious." Charlotte nodded, a knot tightening in her stomach. "Of course, Anya. Standard procedure." She tried to maintain her composure, the professional nurse, but a cold dread had begun to seep into her bones. The ultrasound technician, a young woman Charlotte vaguely recognized from the hospital cafeteria, was uncommunicative, her face unreadable as she moved the transducer across Charlotte's distended abdomen. Charlotte, accustomed to reading the subtle cues of medical professionals, found herself straining, trying to decipher the images on the screen. But the angles were wrong, her knowledge inadequate for this side of the procedure. She saw shadows, vague masses, and a dark, amorphous area that looked like fluid. Ascites. The word whispered through her mind, a terrifying premonition. A few days later, the phone rang. It was Dr. Sharma. "Charlotte, the ultrasound showed some irregularities. We need to do a CT scan, and I'd like to get a CA-125 blood test. Can you come in tomorrow?" The urgency in Dr. Sharma's voice was unmistakable. Charlotte agreed, her own voice strangely flat. The CT scan was a blur of cold metal and the drone of the machine. More shadows, more fluid. Then came the biopsy. Charlotte remembered the sterile smell of the room, the doctor's steady hands, the dull pressure as the needle entered her abdomen. She had closed her eyes, focusing on her breathing, trying to detach, to be the nurse observing a procedure, not the patient undergoing it. The day the call came from Dr. Sharma's office, Charlotte was at home, trying to force down a piece of toast. Her phone, usually a tool of efficiency, felt like a lead weight in her hand. "Charlotte, can you come in this afternoon? We have the biopsy results." Dr. Sharma's voice was softer than usual, a subtle warning. The drive to the clinic felt endless, each turn of the wheel heavy with unspoken fear. She sat in the waiting room, surrounded by strangers, feeling utterly exposed without the shield of her uniform. Dr. Sharma met her at the door to the consultation room, her expression grave. "Have a seat, Charlotte." Charlotte sat, her hands clasped tightly in her lap, her professional mask firmly in place. "What is it, Anya?" Dr. Sharma sat opposite her, placing a file on the desk but not opening it immediately. She took a deep breath. "Charlotte, the biopsy confirmed it. It's stage Wernicke C, high-grade serous ovarian carcinoma." The words hung in the air, each one a hammer blow. Stage 3C, high-grade serous ovarian carcinoma. Cancer, advanced, aggressive. The terms, so familiar from countless patient charts, now applied to her. The widespread peritoneal carcinomatosis, the ascites, it all clicked into place with horrifying clarity. Her body had betrayed her, silently, insidiously. "It's advanced, Doctor," Sharma continued, her voice gentle, "with significant spread to the peritoneum. This explains the ascites we've seen. The prognosis for HGSOC at this stage is challenging. We're looking at aggressive chemotherapy, likely followed by surgery, and then more chemotherapy." Charlotte's mind raced, not with fear, but initially with a clinical detachment. What's the platinum sensitivity? What's the standard regimen? Carboplatin and paclitaxel? She was asking questions, not feeling. She was the nurse gathering data. Dr. Sharma looked at her, her eyes filled with sympathy. "Yes, that's the standard, but Charlotte, this isn't a chart. This is you." And then the clinical detachment shattered. The reality crashed down, a tidal wave of ice-cold dread. Her carefully constructed world, built on control, on self-reliance, on being the unbreakable anchor for everyone else, splintered into a million pieces. The air left her lungs. A profound sense of betrayal, of her own body, of her meticulous routines, washed over her. Fear, raw and visceral, clawed at her throat. She drove home in a daze, the familiar streets blurring through her unshed tears. How could she tell Beatrice? How could she tell Finn? They leaned on her, depended on her unwavering strength. Who would she be if she wasn't the strong one? Beatrice, ever dramatic, dissolved into immediate, noisy tears when Charlotte finally managed to choke out the words. "Oh, Charlie, no, not you. You're always the strong one. What are we going to do? What about everything?" She clutched at Charlotte's arm, her questions frantic and unhelpful, swirling around Charlotte's already reeling mind. Finn, usually so articulate in his coding, retreated into himself. He stood awkwardly, his lanky frame hunched, his eyes wide and unfocused, overwhelmed by the raw emotion he was witnessing. He muttered something about looking up treatment protocols, a desperate attempt to apply logic to an illogical nightmare, before escaping to the quiet sanctuary of his room. Charlotte looked from Beatrice's tear-streaked face to the closed door of Finn's room. In their reactions, she saw her own worst fears reflected. They were lost. And for the first time in her life, Charlotte realized, with a crushing despair, that she was lost too. The earth beneath her had cracked, and she was falling. She, the unbreakable anchor, was sinking. The surgical mask, once a symbol of her professional detachment and control, now felt like a suffocating shroud. Charlotte's carefully curated world, built on precision and predictability, had crumbled into a messy, unpredictable chaos. The news of stage 3C high-grade serous ovarian carcinoma, delivered with Dr. Sharma's somber honesty, still echoed in the sterile confines of her mind. Disbelief had been quickly followed by a cold, reptilian fear that coiled in her gut, a fear she had always prided herself on managing, on pushing down. But this was different. This was her own body, a meticulously maintained machine, betraying her. The first round of chemotherapy, a cocktail of carboplatin and paclitaxel, began with a chilling efficiency. The nurses, her colleagues, moved around her with an almost reverent tenderness, a shift in their usual professional briskness that only underscored her new, terrifying status. Patient. The first few hours were deceptively mild, a quiet hum in her veins. Then the nausea hit, not the gentle queasiness of a bad meal, but a relentless, churning wave that left her weak and gasping, emptying the contents of her stomach with an indignity she found almost as hard to bear as the physical discomfort. Her body, once an obedient instrument, was now a rebellious landscape of aches and tremors. "Can I get you anything, Charlotte?" a familiar voice murmured. It was Maya, her eyes brimming with a concern Charlotte found both touching and deeply uncomfortable. "Some ginger ale? Or I can wet a cloth for your forehead?" Charlotte forced a tight smile. "No thank you, Maya. I'm fine. Just adjusting." The lie felt like ash in her mouth. She wasn't fine. She was a ruin inside, bracing herself for the next wave, every muscle tensed. She was used to being the one offering the comforting words, the one anticipating needs. To be on the receiving end felt like a demotion, a stripping away of her identity. She tried to maintain a semblance of her old routine, a desperate clinging to normalcy. She insisted on going back to work part-time, desk duty, poring over patient charts, her mind stubbornly refusing to acknowledge her own. But the fatigue was a relentless predator, lurking around every corner. By midday, her eyelids would droop, her focus would waver, and the familiar words on the screen would blur into an incomprehensible mess. She'd lock herself in an empty consultation room, just for 10 minutes, just to close her eyes, the shame a hot flush on her pale cheeks. She, Charlotte, who had never needed a break, who had prided herself on her tireless stamina, was now a fragile, wilting thing. Beatrice, bless her chaotic heart, was a whirlwind of well-meaning but ultimately unhelpful gestures. "I've brought you a quinoa salad. It's superfoods, Charlie, you need to eat. Or should I clean the bathroom? I noticed the grout could use a scrub." "Beatrice, please," Charlotte would say, her voice thin with exhaustion. "I'm perfectly capable. I just need a little rest. I'll make dinner later." She wouldn't. The thought of standing in the kitchen, the smell of cooking food, would send another wave of nausea through her. She'd end up picking at a piece of toast, her stomach churning, the vibrant quinoa salad wilting in the fridge. Finn, sensing her withdrawal, would retreat further into his digital world, occasionally leaving a carefully placed energy bar or a bottle of electrolyte water by her bedside, a silent offering of care. The hair thinning started subtly, a few more strands than usual clinging to her comb, then a handful. It was a cruel irony, Charlotte thought, that her body, which had always been a source of quiet pride, strong, resilient, serving her well through countless demanding shifts, was now systematically dismantling itself. She found herself obsessively checking her reflection, tugging at her ponytail, trying to gauge how much was gone. Scarves became her new uniform, then hats, pulled low over her brow. She went to the hospital library on a Saturday, ostensibly to research a new surgical technique, but found herself drawn to a mirror in the women's restroom. She pulled off her beanie, stared at the widening part, the scalp showing through. Her fingers trembled as she ran them through the dull, lifeless strands. This wasn't just hair, it was a visible marker of her unraveling, an advertisement of her vulnerability. One particularly bad evening, after a day that felt like wading through treacle, Charlotte decided she absolutely must prepare a proper meal. She had promised Beatrice and Finn. She pulled out a cutting board, the knife feeling impossibly heavy in her hand. The aroma of garlic, usually a comfort, now assaulted her senses. She felt a cold sweat break out on her forehead. The room began to spin. Her knees buckled. She reached out, grasping for the counter, but her strength gave out. She slid to the floor, landing with a soft thud, the knife clattering harmlessly away. She lay there, sprawled on the cool linoleum, tears of frustration and sheer exhaustion pricking her eyes. The humiliation was a raw, burning ember in her chest. She, Charlotte, the unbreakable anchor, was broken. Utterly, completely broken. The carefully constructed facade, the self-reliance she had championed her entire life, had finally shattered. She reached for her phone, her hand shaking, and for the first time in her life, she didn't call 911 for someone else. She called Beatrice. It was a confession of defeat, a silent plea for rescue. And as Beatrice's frantic footsteps approached, Charlotte closed her eyes, wishing, for the first time, to simply disappear. The shock of diagnosis had given way to the brutal, grinding reality of treatment, challenging not just her body, but the very core of who she believed herself to be. This was just the beginning of the undoing, a prelude to a darkness she couldn't yet fathom. The second cycle of chemotherapy hit Charlotte like a rogue wave, dragging her further under the churning waters of her illness. The nausea, which had been a persistent hum after the first infusion, now roared to life, a relentless, churning agony that made even the thought of food repulsive. The fatigue deepened, a bone-deep weariness that glued her to her bed, transforming her once immaculate apartment into a tomb of unread books and untouched chores. Her meticulously planned routines, the very scaffolding of her existence, had collapsed. But it was her hair that became the starkest, most brutal symbol of her unraveling. After the first cycle, it had thinned, clinging to her scalp in defiant, sparse strands. She'd tried to hide it, first with scarves, then with a series of carefully chosen hats, clinging desperately to the last vestiges of her professional, put-together image. Now, after the second dose, entire clumps came away in her hands with every brush, every shower, clinging to her pillowcase like morbid confetti. One morning, she stood before the bathroom mirror, her reflection a gaunt stranger with eyes sunk deep in bruised hollows. She lifted a hand, and a thick brown mass of hair detached itself, revealing patches of pale, vulnerable scalp beneath. A choked sob escaped her, raw and guttural, unlike any sound she had ever made. She looked at her reflection and didn't recognize the woman staring back. The Charlotte she knew, the strong, unwavering anchor, was gone, replaced by a ghost. "When my hair fell out, the light came in," she whispered. But the words felt like a cruel joke in the face of such profound loss. There was no light, only darkness, as if the universe conspired to strip her of all dignity. The ascites worsened dramatically. Her abdomen, already distended, now swelled to an alarming size, taut and painfully tender. It pressed against her diaphragm, making every breath a shallow, gasping effort. The pain was no longer a gnawing ache, but a searing, constant pressure that stole her sleep and her appetite. Dr. Sharma, her face etched with concern, ordered an immediate hospitalization for paracentesis. Being a patient in her own hospital was an exercise in profound humiliation. The familiar corridors, once a source of professional pride, now felt alien and hostile. The nurses, her colleagues, moved around her bed with an awkward tenderness, their eyes reflecting a pity she couldn't bear. She, Charlotte Davies, the one who orchestrated complex surgeries with an iron will, now lay helpless, dependent on their gentle hands to turn her, to bring her water, to empty her commode. The paracentesis itself was a grotesque ballet of medical efficiency. A long needle, guided by ultrasound, pierced her swollen abdomen, and a gush of yellow translucent fluid began to drain into a collection bag. Hour after hour, the fluid flowed, relieving the pressure, but leaving her feeling utterly violated, exposed and diminished. The sheer volume, nearly 5 liters, shocked even her medical mind. During one of Dr. Sharma's rounds, Charlotte found a rare moment of candor. The doctor sat on the edge of her bed, her expression grave. "Charlotte," she began, her voice soft but firm, "we're seeing some progression despite the chemotherapy. The ascites is a clear indicator. We'll continue with the planned cycles. But I need to be honest with you. This is an aggressive cancer. We're fighting a very tough battle." Charlotte, usually so composed, felt a cold dread seep into her bones. She had always prided herself on facing facts, on understanding the brutal logic of disease. But hearing it articulated so plainly, stripped of medical jargon, felt like a death sentence. "So what are you saying, Anya?" she asked, her voice raspy, a tremor she couldn't control. "Are you saying this is it?" Dr. Sharma reached out, briefly touching Charlotte's hand. "I'm saying we continue to fight. We explore every option. But I also need you to understand the reality of what we're up against. It's not just about the treatment, Charlotte. It's about your body's response. And right now, it's not responding as we'd hoped." The words hung in the sterile air, heavy and unyielding. Charlotte closed her eyes, a wave of profound despair washing over her. She was a nurse. She knew what not responding as we'd hoped meant. It meant she was losing. She pushed Beatrice and Finn away. Beatrice, bless her chaotic heart, tried to visit daily, bringing lukewarm casseroles and endless, well-meaning but ultimately hollow platitudes. "You're so strong, Char. You'll beat this." Charlotte would turn her face to the wall, pretending to sleep, unable to tolerate the forced optimism that felt like a mockery of her internal devastation. Finn, ever sensitive, sensed her withdrawal and retreated into his quiet world, sending texts filled with emojis he probably thought were comforting, but which only highlighted the vast chasm between them. She felt like a burden, a grotesque shadow of her former self, and the shame of it made her lash out, pulling further into herself. "I just need to rest, Beatrice. Please, leave me alone." Her voice was sharper than she intended, tainted with the bitterness of her own helplessness. One night, lying in the hospital bed, the relentless hum of the IV pump the only sound in the dark room, Charlotte stared at the ceiling. Her body ached, her head throbbed, and a raw, empty ache settled in her chest. She had always been the strong one, the fixer, the one who had all the answers. Now she had no answers, no strength, only a crushing, suffocating sense of defeat. She remembered Maya's genuine concern, the fleeting touch of Dr. Sharma's hand, Beatrice's tear-stained face, Finn's anxious eyes. She had pushed them all away. She was utterly alone, adrift in a sea of pain and despair, her carefully constructed identity as the unbreakable caregiver shattered into a million pieces. The light she had once taken for granted, the very essence of her being, had flickered and died. She was in a dark, desolate place, and she saw no way out. The mirror, once a familiar ally in her morning ritual, had become an enemy. Charlotte stared at the stranger reflected there. Gaunt, hollow-eyed, her scalp a pale, mottled landscape where once thick, practical hair had reigned. The last few stubborn strands had finally surrendered, swirling down the drain like tiny dark questions. It wasn't just the baldness, it was the entire package. The sallow skin, the purplish shadows beneath her eyes, the weary slump of her shoulders. This wasn't Charlotte, the unbreakable anchor, the meticulous nurse. This was a defeated woman, stripped bare. The physical indignity was compounded by a new terrifying development. Ascites. Her abdomen, once merely bloated, was now distended to an alarming degree, taut and painful, pressing against her diaphragm, making every breath a shallow, anxious effort. It felt as if an alien presence had taken root inside her, siphoning off her very life force. The fatigue, which she had thought was already at its zenith, found new depths, pulling her into a murky, dreamless sleep from which she awoke feeling even more exhausted. Dr. Sharma's face, usually a picture of gentle resolve, was etched with concern during their last video call. "Charlotte, the ascites is significant. We need to get you in for a paracentesis. It's not just about comfort, it's affecting your breathing." Charlotte had merely nodded, too tired to argue, too defeated to protest. The thought of another hospital visit, another procedure, another invasion of her already violated body filled her with a profound, aching weariness. She was tired of fighting, tired of pretending. The meticulously constructed walls of her self-reliance had crumbled, leaving her exposed to a world that felt increasingly hostile. The paracentesis itself was a blur of sterile drapes, hushed voices, and the cold, blunt pressure of the needle. She felt the immediate relief as the golden fluid, liters of it, drained away, but the humiliation lingered. She, Charlotte, who had always been on the giving end of care, was now utterly dependent, a body on a gurney, subject to the ministrations of others. She saw the pity in the eyes of the nurses, young women she had once trained, and it stung more than any physical pain. She felt like a burden, a failure. She had pushed Beatrice and Finn away, not out of malice, but out of a deep-seated shame. How could they see her like this? The strong one, reduced to this frail, bald shadow. She wanted to disappear, to simply cease to exist. One afternoon, the insistent buzz of her doorbell shattered the oppressive quiet of her apartment. Charlotte, huddled under a blanket on the sofa, debated ignoring it. She had told Beatrice she needed space, had let Finn's calls go to voicemail. She couldn't face anyone, but the buzzing persisted, followed by a gentle, tentative knock. With a sigh that felt too heavy for her chest, she dragged herself to the door, steeling herself for another well-meaning, but ultimately draining encounter. It was Maya. The younger nurse stood there, not with the usual concerned fussiness she'd come to expect from visitors, but with a quiet, almost hesitant demeanor. In her hand, she held a woven basket, a small, unassuming offering. "Charlotte, hi, I was just in the neighborhood. Dr. Sharma said you were home. I hope you don't mind." Maya's voice was soft. Her eyes, though full of empathy, lacked the pity that Charlotte had grown to dread. Charlotte opened the door a fraction wider, a flicker of surprise cutting through her despair. "Maya, what are you doing here?" Her voice was raspy, unused. "Just checking in," Maya said, her gaze steady. "I brought some soup, my grandmother's recipe. It's good for everything." She offered a small, genuine smile. Charlotte wanted to refuse, wanted to retreat into her self-imposed isolation. But there was something in Maya's genuine presence that disarmed her. Maya wasn't asking for anything, wasn't trying to fix her. She was simply there. Charlotte stepped aside, a barely perceptible gesture of invitation. Maya entered, her movements quiet and respectful. She didn't hover, didn't fuss. She simply went to the kitchen, found a saucepan, and began heating the soup. The aroma of chicken broth and fresh herbs slowly filled the apartment, a comforting scent that Charlotte hadn't realized she missed. "You know, Charlotte," Maya said, stirring the soup, her back to her, "when I first started on your unit, I was terrified. Everything felt so precise, so high stakes. I used to watch you, always so calm, so in control. You were like a rock. I thought, if I could just be a tenth as steady as Charlotte, I'd be a good nurse." She paused, turning to face Charlotte, her expression earnest. "You taught me so much, not just about procedures, but about presence, about how to hold it together, even when things are falling apart. Charlotte shifted on the sofa, a knot of old pride and new shame tightening in her chest. "I'm hardly holding it together now, Maya." Maya walked over, carrying a steaming bowl of soup, and sat on the edge of the coffee table. "No, you're not, and that's okay. You taught me that it's okay to be vulnerable too. You just never showed it yourself. I always admired your strength, but I also worried about it, about what would happen if you ever let go." Charlotte picked up the spoon, a faint tremor in her hand. Maya's words were a revelation. She had always seen her own strength as her greatest asset, her shield. Now it felt like a cage she had built around herself. Over the next few days, Maya became a quiet, persistent presence. She didn't push, didn't pry. She simply showed up, sometimes with a meal, sometimes with a book, sometimes just to sit in comfortable silence, offering a quiet companionship that Charlotte hadn't realized how desperately she craved. She'd fold laundry, clean a dish, small acts of care that Charlotte had always insisted she could manage herself. And slowly, painstakingly, Charlotte began to let her. It was a tiny crack, a hairline fracture in the formidable wall she had built around her heart. During a follow-up appointment with Dr. Sharma, Charlotte was waiting for her blood work results when a gentle voice beside her caught her attention. "Charlotte, isn't it?" She looked up to see Father Michael, the hospital chaplain, a man with kind eyes and a perpetually serene smile. She'd known him for years, seen him comfort countless families, but their interactions had always been brief, professional acknowledgments. "Father Michael," she managed, her voice still thin. He sat in the empty chair beside her. "I heard you've been through quite a journey. How are you feeling today?" Charlotte hesitated. How was she feeling? Utterly broken, but she couldn't say that. "As well as can be expected," she replied, the old nurse's automatic response. Father Michael nodded, his gaze distant, as if looking beyond her physical form. "You know, I once spoke to a man, a master sculptor, who told me the most profound thing. He said, 'The most beautiful art isn't what you add, but what you carve away. You have to remove everything that isn't the true form within.' He saw it in the stone, but I've always thought it applies to us too. Sometimes life carves away the parts of us we think define us, our strength, our appearance, our perceived control. And when those parts fall away, what's left is often the most vital, luminous part of who we truly are." He didn't mention her baldness, didn't preach about God or faith. He simply shared a story, a gentle reflection. But his words resonated in Charlotte's empty spaces, particularly the phrase, "When those parts fall away, what's left is often the most vital, luminous part." She looked down at her hands, thin and tremulous, then instinctively touched her bare scalp. Could it be true? Could there be a luminous part beneath the shell of her former self? The thought, for the first time in months, wasn't one of despair, but of fragile, tentative curiosity. The first steps towards opening up had begun. The cool, gentle touch of Maya's fingers on her scalp was a startling sensation. Charlotte had been bracing herself for the cold steel of the clippers, the clinical efficiency of the act, but Maya had brought a soft, electric shaver and a bowl of warm, soapy water. "It's less harsh this way," Maya had murmured, her voice barely a whisper, as if acknowledging the profound weight of the moment. Charlotte had simply nodded, her throat tight, a lump of silent grief and resignation lodged there. She sat on the small stool in her bathroom, wrapped in a faded towel, the mirror before her reflecting a ghost. The last few pathetic wisps of hair clung stubbornly to her scalp, a testament to a battle already lost. Maya began at the crown, the low hum of the shaver a strange counterpoint to the thumping of Charlotte's own heart. Each pass was deliberate, gentle, and with each whisper of the blades, a tiny, almost imperceptible shift occurred within Charlotte. It wasn't despair, not anymore. That had been for the previous losses, the hair falling out in clumps, the desperate attempts to hide it. This was different. This was surrender. When Maya finally stepped back, holding a small mirror for Charlotte to see the back of her head, Charlotte looked at her reflection. Her scalp was pale, smooth, and surprisingly vulnerable. The lines of fatigue around her eyes were starker, her cheekbones more prominent. But there was something else too. something she hadn't anticipated, a raw honesty, a clarity. She looked utterly exposed, yes, but also utterly unburdened. The elaborate facade she had maintained for decades, the carefully coiffed hair, the crisply starched uniforms, the impenetrable composure, it had all fallen away. "It's clean," Charlotte managed, her voice raspy. Maya smiled, a tentative, understanding smile. "It is," she agreed. "It's beautiful, Charlotte." Charlotte felt a strange, unbidden warmth spread through her chest. Beautiful? No one had ever called her beautiful, not in that way. Competent, strong, reliable, yes. But beautiful in her raw, exposed vulnerability? It was a foreign concept, yet it resonated with a truth she was only just beginning to grasp. As she stared at her reflection, a phrase Father Michael had shared during their last conversation echoed in her mind. "Sometimes, Charlotte, when we shed what we believe defines us, we make space for what truly illuminates us." She hadn't understood it then, not fully, but now, looking at the bald crown of her head, a quiet epiphany bloomed. "When my hair fell out, the light came in. The burdens of appearance, of being the unbreakable caregiver, had been a heavy cloak, obscuring something essential. Without it, she felt lighter, more present." The conversations with Father Michael had continued, not in the formal setting of a chapel, but in the quiet, sun-drenched visitors' lounge at St. Jude's after one of her checkups. He never preached, never offered platitudes. Instead, he listened. And when he spoke, it was often in parables or gentle reflections on human nature, on strength found in unexpected places. "We often mistake control for strength, Charlotte," he'd said one afternoon, gazing out the window at the bustling hospital grounds. "But true strength, I've found, lies in the courage to release control, to trust, to allow ourselves to be held. It's in our vulnerability that we often find our greatest power, because that's where true connection begins." It was then, sitting across from him, that Charlotte had confessed the shame she felt about her body, the ascites that made her feel grotesque and alien. Father Michael had simply listened, then shared a story about a medieval mystic who believed the body, in its suffering, could become a chalice for grace. He didn't promise a cure, but he offered a different lens through which to view her pain, not as a curse, but as an unlikely crucible for transformation. The shift wasn't instantaneous, nor was it a sudden surge of boundless optimism. It was a gradual unfolding, a quiet blossoming of acceptance. Maya, with her unwavering presence, was a constant anchor in this new, uncharted emotional landscape. She didn't just bring meals or do laundry. She offered companionship, a non-judgmental space for Charlotte to simply be. One afternoon, Maya had been folding laundry, Charlotte's own worn scrubs, and had quietly said, "You know, Charlotte, when I was a new grad, I was so scared. I thought I had to know everything, be perfect. But you showed me that it's okay to ask for help, to learn. You were tough, but fair. You made me stronger." Charlotte had felt a pang. Was she tough? Yes. But had she ever allowed herself to be helped? Had she truly allowed herself to learn from being a patient? The answer was a resounding no. And in that moment, she realized that her unbreakable facade hadn't just shielded her. It had also created a barrier, preventing genuine connection, preventing her family from truly seeing and supporting her. That evening, a wave of profound remorse washed over her regarding Beatrice and Finn. She had pushed them away, convinced they couldn't handle her illness, or perhaps, more truthfully, convinced she couldn't handle their care, their worry, their vulnerability mirrored in her own. She picked up her phone, her fingers hovering over Beatrice's contact. It felt like dialing a foreign number. "B!" she rasped when her sister answered, the surprise evident in Beatrice's voice. "It's Charlotte." There was a pause. "Char? Are you all right? You sound different." I'm trying to be," Charlotte admitted, a tear escaping the corner of her eye. "I wanted to apologize for pushing you away, for being difficult." The words felt clumsy, unfamiliar on her tongue. Beatrice's voice, usually a torrent of effusive emotion, softened. "Oh, Char, you don't have to apologize. We've just been so worried. We just want to help." "I know," Charlotte said, a quiet sob escaping her. "And I think I'd like that now, if you still want to." The floodgates opened. Beatrice was at her apartment within the hour, Finn trailing awkwardly behind her. This time, Charlotte didn't bat away Beatrice's tearful embrace. She let her sister hold her, truly hold her, for what felt like the first time in decades. Finn, true to his nature, didn't say much, but he quietly started tidying the living room, a practical act of care that spoke volumes. The apartment, which had felt like a suffocating tomb, suddenly felt lighter, filled with an hesitant, fragile warmth. With Maya's encouragement, Charlotte started venturing out. Her first outing was to a hospital support group for cancer patients, a place she would have scoffed at a few months prior, viewing it as a space for the weak. She walked in, bald head proudly, if a little nervously, exposed, and sat amongst strangers, all bearing their own silent burdens. When it was her turn to speak, she found herself sharing not just the clinical details of her diagnosis and treatment, but the profound emotional and spiritual unraveling she had experienced. She spoke of the shame, the fear, the anger, and then the surprising liberation that came with shedding her external identity. "I was Charlotte, the nurse," she said, her voice steadying, "the one who always had it together, the one who fixed things. And when I couldn't fix myself, when my body betrayed me, I felt utterly lost. But then, when everything fell away, when even my hair was gone, there was this strange sense of freedom. It was as if, without all the layers I'd built up, I could finally see myself truthfully, and I could finally let others see me too." A woman with a vibrant headscarf, her eyes kind, nodded slowly. "When my hair fell out, the light came in," she echoed, a quiet understanding passing between them. Charlotte found herself not only receiving support, but also offering it. She listened to others' fears, their frustrations, their quiet triumphs. She shared practical advice from her nursing background. But more importantly, she shared the wisdom she was gaining from her own journey. The profound resilience of the human spirit, the unexpected strength found in vulnerability, the quiet miracle of allowing oneself to be cared for. She found a new purpose, not as the meticulous, detached professional, but as a fellow traveler, a wounded healer. Her hair had been a crown of her perceived strength, her control. Now, its absence was a symbol of her liberation, a beacon of a different kind of light. The small, almost imperceptible shift Charlotte had felt during the ritual of shaving her head had blossomed into something more profound, a quiet, radical acceptance. The mirror, once an enemy, was now simply a surface reflecting a new truth. Her bald head wasn't a mark of defeat, but a canvas on which a different story was being painted. She'd started wearing vibrant scarves, not to hide, but to adorn, a playful defiance against the somber expectations of illness. She even found herself on occasion walking around her small apartment with her head uncovered, feeling the cool air against her scalp, a sensation that was strangely liberating. Her conversations with Father Michael had deepened, moving beyond abstract reflections to raw, honest exchanges about fear, faith, and the elusive nature of control. He didn't offer easy answers, but rather a comforting presence and a way of reframing her suffering. Sometimes he'd mused one afternoon over lukewarm hospital coffee. The greatest healing isn't the absence of pain, but the presence of meaning within it. It's in the letting go that we truly grasp. Charlotte had understood, letting go of the perfect nurse, the caregiver, the impenetrable shield, letting go of the fear of being seen as weak. She'd even managed to mend some of the frayed edges with Beatrice and Finn. It started awkwardly, with Charlotte issuing a stilted apology for her earlier dismissiveness. Beatrice, ever the emotional one, had dissolved into tears, pulling Charlotte into a fierce, if somewhat clumsy hug. Finn, surprisingly, had offered a quiet, "It's okay, Aunt Charlotte. We just want to help." It was a tentative step, but it was a step. She allowed Beatrice to bring over homemade, if slightly burnt, casseroles, and let Finn fix her perpetually glitchy Wi-Fi without hovering over his shoulder. The apartment, once a fortress of her self-sufficiency, now echoed with the gentle sounds of shared life. The support group, the light within, had become an anchor. Sitting in a circle with other patients, sharing stories of nausea, hair loss, scans, and the bewildering emotional roller coaster of cancer, Charlotte found a new kind of community. She spoke not as a nurse dispensing advice, but as a fellow traveler, her voice raspy from fatigue, but clear with newfound empathy. She shared her own journey with the hair, the symbolic act of liberation, and saw heads nod in understanding, tears welling in some eyes. It was a strange, beautiful alchemy, turning shared vulnerability into collective strength. But even as her spirit soared, her body remained a fragile vessel. The ascites, though managed by periodic paracentesis, was a constant, uncomfortable reminder of the enemy within. The fatigue was a heavy cloak she could never fully shed. And then, one ordinary Tuesday morning, it happened. It began as a dull ache in her lower right abdomen, easily dismissed as gas or a lingering effect of the last chemo session. But within hours it intensified, morphing into sharp, unrelenting spasms that gripped her like a vice. Nausea, already a familiar foe, escalated into violent, dry heaves that left her trembling and gasping for breath. She tried to stand, to get to the phone, but a wave of dizziness washed over her, and she crumpled to the floor, the world tilting precariously. "Maya," she managed to croak, fumbling for her phone, her fingers slick with cold sweat. Maya was there within 20 minutes, her face etched with immediate concern. She took one look at Charlotte, pale and clammy, clutching her distended abdomen, and her nurse's instincts kicked in. "Bowel obstruction," she muttered, her voice firm, already reaching for her own phone. "Charlotte, we need to get you to St. Jude's. Now!" The ride to the ER was a blur of excruciating pain and Maya's calm, reassuring voice. Once there, the familiar sounds and smells of the hospital, usually a source of comfort and control, now felt alien and overwhelming. She was the patient, truly and irrevocably dependent on the very system she had once commanded. Dr. Sharma met them in the ER, her expression grim. A quick physical exam, followed by an emergency CT scan, confirmed Maya's suspicion. "It's a bowel obstruction, Charlotte," Dr. Sharma explained, her voice gentle but serious. "Likely due to tumor progression or adhesions. We need to go in. Emergency surgery. There's no other way to relieve it." Charlotte's mind, despite the pain, was sharp. She knew what this meant. A compromised immune system, weakened body, the risks of general anesthesia, the potential for further complications. Her prognosis, already challenging, would undoubtedly worsen. A flash of the old Charlotte, the one who fought every battle, who demanded every detail, who worried over every risk, surged momentarily. But then something shifted. A profound stillness settled over her. She looked at Dr. Sharma, then at Maya, whose hand was clasping hers tightly. She thought of Beatrice and Finn, their earnest attempts to care for her. She thought of Father Michael's words about surrender, about finding meaning in the letting go. And she thought of the light that had come in when her hair fell out. "Dr. Sharma," Charlotte said, her voice surprisingly steady, though raspy with pain. "I trust you. I trust your team. Do what you need to do." She squeezed Maya's hand. "Tell Beatrice and Finn I love them. And thank you, Maya, for everything." There was no fear in her eyes, no despair, only a deep, calm acceptance that startled even Dr. Sharma. It wasn't resignation, it was a profound release. She was letting go of the outcome, letting go of the control, letting go of the fight. She was placing herself entirely in the hands of others and in the hands of something larger than herself. As the pre-op nurse wheeled her towards the operating theater, Charlotte closed her eyes, a strange sense of peace washing over her. She was floating on the precipice, not of an ending, but of an unknown beginning. The surgery itself was a grueling affair. The obstruction was indeed significant, a tight band of tumor and adhesions constricting the bowel. Dr. Sharma and her team worked with meticulous precision, carefully dissecting the affected area, relieving the pressure. But as they explored the abdominal cavity, something remarkable, something truly inexplicable, began to emerge. The widespread peritoneal carcinomatosis, the insidious, star-like growths that had once blanketed Charlotte's organs, were different. There were still signs of disease, yes, but many of the previously large, aggressive implants had visibly shrunken, some appearing almost necrotic, others faded to mere shadows. It was a regression far beyond what they had expected, far beyond what the chemotherapy alone should have achieved in such a time frame. Dr. Sharma paused, her brow furrowed, a flicker of professional awe mixed with confusion in her eyes. It was subtle, almost imperceptible to the untrained eye, but to her it was undeniable. A whisper of an impossible turn, just beneath the surface. The obstruction was addressed, the surgery complete, but a silent, profound question hung in the sterile air of the operating room. The conversation with Father Michael had been interrupted by a sudden, searing pain in her abdomen, far worse than anything she'd experienced before. It wasn't the dull ache of ascites, nor the sharp, intermittent jabs of her early symptoms. This was an all-consuming, twisting agony that bent her double, stealing her breath. Maya, who had just arrived with a bowl of homemade soup, dropped it with a crash, her face paling. Within minutes, Charlotte was violently ill, the retching dry and agonizing. Maya, ever the nurse, sprang into action, her calm competence a stark contrast to Charlotte's rapidly escalating distress. She called Dr. Sharma directly, bypassing the usual channels, her voice firm and urgent. "It's Charlotte, Dr. Sharma. Acute abdominal pain, severe, non-productive vomiting. I'm concerned about an obstruction." The ambulance ride was a blur of flashing lights and the guttural groan of the siren, each bump of the road sending fresh waves of nausea and pain through her. At St. Jude's, the familiar hospital corridors, once her domain, now seemed alien and menacing. She was whisked into emergency, a flurry of hurried assessments and hushed consultations. Dr. Sharma's face, usually so composed, was etched with concern as she explained the situation. "Charlotte, your scans show what appears to be a complete bowel obstruction," Dr. Sharma explained, her voice gentle but serious, "likely due to tumor progression or adhesions from the existing disease. We need to go in immediately. It's an emergency exploratory laparotomy to identify the cause and relieve it. There are significant risks given your current weakened state and the extent of the carcinomatosis." Charlotte felt a strange sensation wash over her. Not panic, not the crushing despair that had once been her default. Instead, it was a profound wave of acceptance, almost a serenity. The pain was still there, a monstrous entity within her, but her mind felt clear, strangely detached from the immediate terror. She looked at Dr. Sharma, then at Maya, who stood by her gurney, holding her hand, her eyes brimming. She thought of Beatrice and Finn, who were likely rushing to the hospital now, frantic with worry. "I understand, Dr. Sharma," Charlotte said, her voice raspy but steady. "I trust you. I trust the team. Whatever comes." She squeezed Maya's hand. "Thank you, Maya, for everything." This calm acceptance was a radical departure from the Charlotte of a few months ago, who would have demanded every detail, questioned every decision, fought for control until her last breath. Now she simply let go. She surrendered to the skilled hands around her, to the unknown future, to the process. The operating room was a dazzling array of lights and chrome, the air thick with the smell of antiseptics. As the anesthetic began its slow, sweet embrace, Charlotte's last conscious thought was of the light she'd found within, a quiet glow that seemed to expand to encompass everything. The surgery was long, tense, and complex. Dr. Sharma, assisted by a senior general surgeon, carefully navigated the dense, scarred landscape of Charlotte's abdominal cavity. What they found, however, stopped them cold. The obstruction was indeed there, a loop of small bowel tightly kinked by a band of fibrous tissue. But the widespread peritoneal carcinomatosis, the myriad tiny implants that had carpeted Charlotte's peritoneum and suffocated her organs just weeks ago, were different. "Are my eyes deceiving me?" Dr. Sharma murmured to her colleague, her voice hushed with disbelief as she gently palpated a section of bowel that should have been studded with tumor. "The disease load, it significantly regressed. These aren't just smaller, they're almost gone." The general surgeon nodded slowly, his expression mirroring hers. "Remarkable. Far more than we'd anticipate at this stage, even with a strong response to chemo. It's sparse, like a forest after a fire, but the embers are all but extinguished." They carefully lysed the adhesions, freeing the obstructed bowel. The procedure itself was a success, but the finding of the dramatically regressed cancer, a regression far beyond the expected, left the surgeons exchanging bewildered glances. It was as if the cancer had simply melted away. Charlotte's post-operative recovery was nothing short of astonishing. She woke from the anesthetic feeling weak, but the searing pain was gone. Her energy, which had been so utterly depleted for months, seemed to return in surges. Her bowels began to function again within days, defying the typical slow recovery from such extensive abdominal surgery. The nurses couldn't believe her rapid progress, whispering about her miracle recovery in the hallways. A week later, still in the hospital but preparing for discharge, Dr. Sharma walked into Charlotte's room, a sheaf of papers in her hand, her usual composed demeanor replaced by a look of open bewilderment. "Charlotte," she began, pulling up a chair and sitting down, "we received the pathology report from the tissue we biopsied during the obstruction surgery, and we also fast-tracked your post-op PET scan." She paused, taking a deep breath. "The scan shows only residual microscopic disease. The widespread peritoneal implants, they virtually vanished. The tumor markers in your blood, they've plummeted to levels we rarely see, even in patients who achieve complete clinical remission." Charlotte listened, her heart thumping, a strange mix of disbelief and profound gratitude washing over her. "Medically," Dr. Sharma continued, her voice tinged with awe, "I have no explanation for such a dramatic and rapid response. Your chemotherapy regimen is standard, and while some patients respond well, this level of regression, especially given the aggressive nature of your tumor and the extent of the disease, it's unprecedented in my experience. It's as if something fundamentally shifted." She looked at Charlotte, her gaze searching. "Whatever you're doing, Charlotte, keep doing it, because something truly remarkable has happened." Charlotte felt tears prick her eyes, not of sadness, but of overwhelming gratitude. Gratitude for her doctors, for Maya, for Beatrice and Finn's unwavering love, for Father Michael's quiet wisdom, and for the painful, transformative journey that had forced her to shed her old self, allowing a new luminous Charlotte to emerge. The light indeed had come in. Her physical strength was returning rapidly, a renewed vitality thrumming beneath her skin. She had been on the precipice, and instead of falling, she had soared. This wasn't just a recovery, it was a rebirth. The emergency surgery, performed by Dr. Sharma herself, was a harrowing ordeal. Charlotte remembered flashes, the sterile cold of the operating room, the hushed voices of the surgical team, the brief, reassuring squeeze of Dr. Sharma's hand before the anesthesia mercifully pulled her under. Maya had been there too, a pale but determined face in the pre-op, offering a silent vow of presence. The obstruction, a tangled knot of bowel compressed by a rapidly growing tumor, was dealt with. But what truly astonished Dr. Sharma and her team was what they found beyond the immediate crisis. During the exploration, traditionally a grim accounting of widespread disease, there was less, significantly less. The pervasive, granular peritoneal implants that had coated Charlotte's abdominal cavity like a morbid frost were largely gone. What remained were only scattered, almost microscopic flecks, barely discernible. It was as if a tide had receded, leaving behind only remnants of what had once been an overwhelming ocean. Dr. Sharma, a woman of science and empirical evidence, performed the necessary surgical repairs with meticulous precision, but her mind reeled. Such a rapid, near-complete regression of stage 3C HGSOC with extensive carcinomatosis was, in her long and distinguished career, unheard of. The post-operative recovery, against all expectations, was astonishingly smooth. The immediate hours were still clouded with pain and the lingering fog of anesthesia, but the severe, crushing discomfort of the obstruction was gone. Within days, Charlotte was sitting up, then taking tentative steps. Her appetite, long diminished, returned with a surprising vigor. The ascites, which had plagued her for months, had not returned with its previous vengeance. She felt lighter, not just physically, but a profound internal lightness. Dr. Sharma, during her daily rounds, would stand at Charlotte's bedside, a thoughtful frown etched on her brow. "Charlotte," she'd begun one morning, her voice low, "the pathology from the surgery confirms the obstruction was indeed caused by a recurrent tumor site. We've removed it. But what we found, it's truly remarkable. The overall tumor burden has decreased to an almost undetectable level. We'll follow up with a PET scan, of course, but based on what we saw in surgery, it's extraordinary." She paused, searching for words. "Medically, Charlotte, there's no textbook explanation for such a dramatic and rapid response following your last cycle of chemotherapy, especially after such extensive disease." Charlotte simply nodded, a serene smile gracing her lips. She didn't need a medical explanation. She understood. It wasn't just the chemo, potent as it was the letting go, the surrender, the spiritual shift that had occurred when the last of her hair fell, and the light truly came in. When the follow-up PET scan results came back a few weeks later, they confirmed what Dr. Sharma had seen. Only residual microscopic disease remained. The widespread peritoneal implants had indeed vanished. The medical team was baffled, their reports filled with cautious optimism and a strong sense of wonder. An exceptional responder was the term they settled on, a clinical euphemism for, "We don't quite know how this happened." Charlotte's physical strength returned with a quiet, steady resolve. She walked the hospital corridors, no longer an invalid, but a woman reborn. She went home not to the familiar, weary routine, but to a life imbued with a new, vibrant purpose. Beatrice and Finn, witnessing her transformation, were filled with a mixture of awe and profound relief. Their relationship, once defined by Charlotte's stoic strength, was now forged in mutual vulnerability and genuine, unburdened affection. They cooked together, laughed, and simply sat in comfortable silence, their presence a balm. Maya visited constantly, her face alight with joy. She was no longer just Charlotte's mentee, but a trusted confidant, a friend who had seen her at her absolute lowest and loved her anyway. They spoke for hours about their experiences, sharing the unique perspective of nurse and patient, a bond forged in the crucible of illness. Charlotte knew her journey wasn't over. The threat of recurrence would always linger, a quiet shadow, but it no longer held the power to paralyze her. She had faced the abyss and returned, not empty-handed, but with a profound understanding of what truly mattered. She was ready for whatever came next, her spirit fortified, her heart open, and her head gloriously, unashamedly bald.